the Pediatric Lounge, a podcast taking you behind the door of the physician's lounge to get a deeper insight into just what docs are talking about today. From the clinically profound to the wonderfully routine and everything in between.
So as we get ready for November, I wanted to make sure you were aware of this invitation to the Eighth Symposium, General Population Screening for Type 1 Diabetes, November 10th through 11th at the Barbara Davis Center for Diabetes. This symposium aims to explore the expanding evidence and current international efforts to identify pre-symptomatic T1D, emphasizing the potential benefits such as delayed progression and prevention of complications. Of particular interest to general pediatricians will be November 10th, consensus and screening for early stage T1D, as a lot has changed in the last couple of months. And then, of course, on November 11th, I'll have the pleasure of speaking at 8:55 Mountain Time on We Can Do This, and we will have Dr. Martha Middleness talk about limits of primary care, as well as Anastasia Albanese O'Neill from Breakthrough Type 1D on educating clinicians on how to do this in their offices. I definitely hope that you can join us, and I will put the link below. And it is an in-person or virtual, so you can join via Zoom, and it's recorded, so if you have to see patients, you could see the rest of it later. I do hope that you join us and we move forward in screening early to prevent DKA and give children the opportunity of life-saving, disease-modifying medications. Hey, George, good to see you.
How you doing today? It is Tuesday once again at the Pediatric Lounge. And let's introduce a wonderful guest, Dr. Eric Wargotz. I hope I said that. And topic of discussion, medical leader, pathologist, judge, husband, and friend. Take it away.
Today we're honored to welcome Dr. Eric Wargotz, my friend, an accomplished pathologist, judge, and C-suite leader, whose multifaceted career spans medicine, law, academia, and the arts. Eric currently serves as president-elect of MedChi, the Maryland State Medical Society. He recently made headlines for his generous donation to Wigs for Kids and his article on how to screen for colon cancer by getting a blood test. Welcome to the show, Eric.
It's great to see you, gentlemen. George Earp, it's so kind and generous of you to invite me onto your cast. I really appreciate the opportunity to speak with all of you and your guests.
Thank you. Thank you. Do you remember how we met, Eric? I was thinking how we met, and I can't remember all the weddings, funerals.
It most certainly had to do through a gathering at your lovely home where my wife and I were invited. I do recall it was a event. You were having a barbecue or something, and you invited a number of people, your sisters and my wife, who's a friend of yours, and we all came down. And now I remember that was the first time.
I remember it differently. I remember the first time that I remember seeing you, because I've known your beautiful wife since she was in middle school, is an invitation to your house. I don't think you even had children then.
You know what? Both memories are fabulous, and there's no sense debating it.
So that's what I remember. So who was Dr. Lee Laser?
Doctor, there's two of them, actually.
Yes.
It's a husband and wife dynamic duo who practiced in Prince George's County for many years. My father-in-law, Reynaldo Laser, general surgeon, has since passed. And his lovely bride, Dr. Zoraida Lee Laser, who's a critical care specialist, she still practices to this day. And she gives her regards. I told her we would be speaking.
Oh, wonderful. You had a very heartwarming and I thought a very gentleman story to share at his funeral about when you decided you wanted to date Cheryl. Would you mind sharing that lovely story for our guests, for our listeners today?
I'm happy to talk about that, Cheryl Ann and MedChi and all the good stuff that you're after. But on the personal note, no, I don't mind at all. I was friends and colleagues with both her parents at the same hospital for many years. And I was invited over along with a number of other physicians to hear about a business opportunity. And we met at their home in Maryland. And I ring the doorbell, and the door opens, and this vision of beauty, big smiles, greets me. And I'm just looking into this beautiful face and this huge smile, thinking to myself, my God, what a lovely creature God has put on this earth, and now is presenting her to me through this open doorway. I said, my God, this woman is so magnificent. And then she talked and we chatted, and she directed me where to go in the basement. And I went downstairs. I was just totally smitten. I couldn't get her out of my head. And I come down. Her father says, Eric, come here, sit next to me. They're Filipino. I'm sorry, I don't do a good accent. And I'm not even truly intending to do an accent, but he sounded a little like that. And he called me over to sit next to him. And I'm trying to be coy about learning about who this young lady is who answered the door and directed me downstairs. And I say to him, who's that young lady who opened the door, greeted me? And he looks at me and with a question mark, and he says, oh, that's Cheryl Ann. That's my daughter. And I said, you all never told me you had daughters. I know you had 4 sons. And so then he just across the room yells, Cheryl Ann, come here, meet Dr. Wargotz. And so he formally introduced us. I went home that day, couldn't get her out of my head. I was totally smitten. And I tried to figure out ways to see her again. And I thought about all the reasons why we wouldn't be dating, all the potential obstacles. And then finally I decided I wanted to date her. So I'm in the hospital. This is several months later. And I try to get both her parents downstairs into my office on the first floor at the same time, but they were tied up separately. So I brought down Dr. Zoraida Lacer first, and I said to her, I wanted to court her daughter. And she smiled and shook her head up and down. And she said, have you spoken with Ronaldo yet? And I said, no. And she said, it's fine with me, but you ought to speak with him before, anything happens. And so finally he came down later, very stern. He's a serious guy, but he had his light moments. He was serious. I guess maybe she gave him the heads up. And he came in the office. I asked him to take a seat, and I asked him if I could court Cheryl Ann. And he said yes. And he gave all these conditions. And one of them was that I had to drive from the Eastern Shore where I lived to court her from Montgomery County, Maryland. And so that I did. So I went through that formal process because I knew her parents were traditional folks. A lot of people probably do understand that the Philippines was a Spanish colony for about 300-400 years. And then after the Spanish-American War in 1898, it was a war prize along with Puerto Rico to the United States. So it's a lot of the Spanish tradition. And of course, asking one's parents' prospective date for permission to court is a very strong tradition. Wouldn't you say, Herb?
Yes, I think that exemplifies the story of your life. Is a story of respect and kindness and understanding for other people. And that's why it so touched my heart that in this day and age where people meet each other on apps, there are still people that did things the right way, asking the parents of the girl, the woman, if it's okay to ask their daughter out.
I also knew
civility. That civility is incredibly important and lacking in our society today.
I agree with you. And of course, that was a short while ago. And I guess the scandal was that I asked her to marry me 6 weeks after we started dating. And we got married about a year from when we laid eyes on each other. And the scandal, of course, you can imagine in any culture was that, oh, she must be pregnant. And she wasn't. But that's it's like, where's true love? Where you found your mate, you're ready to move on to the next step. But we both laughed a lot about that because we had many questions.
So now you started your career as an actor and a guitar player.
I dabble in guitar, and I did do 7 years of stage in the Jersey Shore, New York area as a teenager. And then during residency, I took a few acting for the camera courses. And I continue to do a little background work, but nothing like I used to do before. I don't do auditions and seek principal parts any longer. It's just busy. Life is busy, and you pick and choose, make priorities.
And the guitars, is it electric guitars that you play, or is it acoustic guitars?
Both.
You can see that George is somewhat of a fan of guitars.
Yeah. Okay. We have many of them. I mostly pick them up, repair them, and I've sold a number of them. But my children all enjoy playing the guitar, and Cheryl Ann and I are constantly lifetime learners of guitar.
Very nice.
Guitars and guitar players, it's just a bad habit. You just
I see what you have behind there.
More guitars for no good reason. It's like ladies in their bags.
It is. There's a T-shirt that says, "Be glad your child is a guitar player and collects guitars. Otherwise, they'd be spending their money on drugs." Because guitars, people just collect guitars. They get 5, 10, 15, 20.
For no good reason. In my house, a lot of guitars because I play and both my sons play.
Oh, good. How lovely.
I can only imagine. Now they're out of the house, but I can only imagine how many guitars were in this house because it's his.
So I count 5 behind you there.
That's what you see over there. I have another 5 downstairs. I just keep moving them around to confuse my wife.
To serenade her, of course.
And Eric, what is it like to be a leader and an owner of a pathology group? It must be very different than being a leader or owner of a pediatric group.
It probably has similarities, covering the work demands of staff. And when people aren't available for whatever reason, you fill in yourself. So you end up putting in a lot more hours, maybe where you didn't plan, because you're the one that's got to fill in if no one else can. And then, of course, the revenue flow cycle issues that come up over time as cuts are being made to medical payment of physicians and the challenges associated with that. Medicare cuts, Medicaid cuts, private insurer cuts, patients not paying their share, and you end up forgiving a lot of payments. So I'm not complaining. I am honored to be a physician. I value it, I treasure it, and I feel absolutely honored to serve in the role that I am serving. But these are some of the challenges you have on the business side of practicing medicine as a private practitioner.
And it's got to be harder for you hospital-based because you don't get to screen your patients. Whoever comes in, biopsy, whatever it is that gets sent to the lab, you don't get to screen them. You don't have their credit card on file. And if they don't pay, you're done. It's just, you did the work for free.
Yeah, so I apologize that I'm not 100% certain who your listeners are, if they're physicians and non-physicians. I assume it's a mix of both. And I would say, for those who don't understand how it works with hospital-based physicians, that we rely on the hospital to collect the appropriate information, including your insurance information. And sometimes when you get frustrated that you're getting a bill from us and your insurance wasn't billed, it's not really the anesthesia group or the radiology group or the pathology group that's at fault there. It's the information wasn't necessarily inputted or acquired properly on the registration end when you came into the hospital. It's, again, we're not here to blame, just wanted to explain what that may mean sometimes so you understand how it all works, a better understanding of it.
Yeah, thank you for that clarification. Now, you ran for Senate in Maryland, and I had the pleasure of campaigning with you.
You're very good.
Why did you run for Senate?
So I ran for U.S. Senate in Maryland against an incumbent, a very strong and powerful incumbent, with a lot more money in the war chest than I had, was able to raise. But people tell me I ran a respectable campaign. Some would even say formidable, but I didn't win. I think that's clear. So why did I run? You see what's happening in healthcare today. Healthcare was one of my primary motivations. And it's funny, you see what the federal government, and of course, HHS is promoting this MAHA, Make America Healthy Again. My slogan back then in 2010 was Make America Healthy and Strong. And so they can thank me for putting that in their heads, I guess. But the reality is I was very concerned about our healthcare system, both the payment, provision of services by physicians, the ability of patients to access healthcare, and the quality of healthcare that was being provided. And of course, the portability of insurance, which is a whole nother discussion, of which there is not great portability of insurance. What that means is being able to take your insurance program across state lines. Should you move or should you need care, it changes. They're not necessarily reciprocal, and it's a hindrance to quality healthcare. So I was very focused on healthcare along with the national issues at the time, but it really focused a lot on healthcare. And I want to do something about it.
We had the pleasure to meet Governor O'Malley at one of the polling stations. And I was surprised at what friendly relationship you guys had and how tall he was. I think he's still alive, right? He's very tall, very handsome, very kind.
Guitar
Stopped, said hello, talked to us.
Yes, he plays the guitar. And so my relationship with a lot of the other politicians in Maryland goes back to when I was county commission president in Queen Anne's County from 2006 to 2010 as county commission president, the first 2 years, and the second 2 years of the term, what we call county-wide or at-large member of the commission. And I got to meet and work with many individuals of both parties, both dominant political parties throughout the state of Maryland. And Martin O'Malley was one of them that we had contact with and saw him often at various functions. And I remember that day on election day in Montgomery County, you came up and you were with me, and I greatly appreciate that, of course. It warms my heart to think about it. And the funniest thing, here's the funniest thing, the backstory is that I went in to use the men's room. And it was a funny little men's room because there was a wall turned a little. So his security guy comes in, and I could see him. I guess he couldn't see me. It was around a little corner, and he looks around to scout out, make sure nobody's there. I didn't know what was going on. And then Martin O'Malley comes in, and I come out and I say, "Hey, Governor O'Malley, how are you?" And he's like shocked because he thought the whole room was cleared. I thought he would literally cause himself an accident. But anyway, so that was a funny moment.
What is he doing nowadays? I thought he was going to run for president, but I don't
know what he's doing. I didn't have a personal relationship with a lot of these people.
I don't know what he's doing today. Now, why, how, and what do you do as a judge? You're a doctor.
I've stayed in elective politics. I believe in community service in many ways, and this is one way I could do it. As a pathologist, we deal with a lot of serious disease as well as death. We occasionally do autopsies and determine cause and manner of death. And we sometimes speak to families about the findings. And it seemed to me that I also was interested in helping. I wanted to help families on the other side of that equation. What happens when you lose a loved one and all the affairs that need to be placed in order if they weren't in order before death? And so I've always had an interest in law. I'm a law school dropout. and in good standing, mind you. I have a letter to prove it. And so this was a way where I could be involved with the law, the administration of the law, without going back to law school. So let me backtrack and explain briefly. In Maryland, we still have what's called the orphans court system. It's the equivalent, more or less, to probate in all other states. But in Maryland, it's elected position for 4 years by party affiliation. And you're responsible for estates and guardianships. And so that's for nearly 12 years. That's what I've been doing in the elective realm on the bench as an orphan court judge. And so I find it very satisfying to assist with resolving issues with families following the death of a loved one.
And is this like a couple of days a week that you have to go into and sit with a black robe and everything else, or just...
it's a black robe, and it's a formal setting, and it's 1 day a week.
1 day a week. All right.
We have a docket, we have hearings, all of that sort of thing.
And then do you have a legal clerk?
The Register of Wills functions essentially as our law clerk or clerk of the court.
Okay. That's so interesting.
It's it's very satisfying. Thanks for asking about it.
So I want to pick your brain a little bit about innovation, because you're a physician leader and innovator. And that article that you shared with me and talks about this new blood test to diagnose colon cancer.
So I put together a few points. I'm not going to put them on the screen, but if I can summarize, because we're not going to read the article, and I'm sure most of your viewers have not. So if I may, I just want to casually mention that in my recent Baltimore Sun op-ed, I talked about how innovations to cancer screening they're opening new doors for early detection. And that's helping people take control of their health before symptoms appear. And so that's 5 points I'd like to make. Just last week, I don't know if I sent it to you, Herb, but a recent BBC News article highlighted how quickly this field is advancing with new technologies that can detect cancer through simple blood drawers, which is what I wrote about, including tests being developed to screen for multiple types of cancers. Again, I can follow up and send that. One example I mentioned in my op-ed was the Shield by Guardant Health. That's GUARDANT, Shield, SHIELD, and it was just approved by the FDA, and I'm very excited about it. I'm not a paid spokesman. I'm very excited about it. And it's the first blood-based test for colorectal cancer screening. It's a major step forward in making screening more accessible for people who might otherwise put it off. And so it's important to understand these innovations aren't meant to replace colonoscopies or stool-based tests, but to complement them and give patients and physicians more options to stay ahead of cancer. So the bottom line is simple. The best test is the one that gets done. In the lab business, we say that all the time. And in your business, probably prescribing certain things, if they don't get the test done, that's not a good test. So the best test is the one that gets done. We got to work towards making it easier for people. So whether it's colonoscopy, stool test, or one of these new blood-based options, we know early screening saves lives. So that's the essence of it. Thanks for the time.
Yeah, that's very interesting. And it just came out. So it's probably not covered by commercial insurance yet.
It is actually. Most insurances are covering it. Don't ask me Medicare, which I just asked myself. I'm not, you know what? I should know that. If it isn't, it will be.
And do you know there's cost sharing associated with it, or?
I don't expect there are, or maybe don't know, in Medicare, there are a few screening tests which are fully covered, but many are an 80-20 situation. And I hate to leave any inaccuracy or any question marks.
Yeah. So we'll figure it out. And I shared with you the use of autoantibodies for autoimmune diabetes and immunotherapy. That's another area where things are like what you're saying, screen early, diagnose early.
And what you run up against is everyone talking about costs, insurance companies, the government. It all has a cost associated with it. So we all have dollar signs on our heads, little kids to old elderly adults.
Yeah. I don't know how we navigate that, right? Because there is a limited amount of resources, no matter what the resource is. but you can do a lot of good with some
It
of
is.
these.
I just want to backtrack for a second
Okay,
that the Shield test by Garden is Medicare covered.
great. And
But
then,
how we deal with that is we should have a future conversation, because that would take easily an hour just to
yes,
talk about the economics of our healthcare system and how wrong it is arranged
yes.
poorly.
By that, I'm assuming you mean that we pay a lot for surgical procedures or end-of-life care and not enough in prevention.
That is certainly part of it. The other part of it is obvious. I'll give you what I ran on 15 years ago, if you remember. We all have 46 chromosomes. We're all related. We're all in this together. And they can say 22% of GDP is too much to spend on healthcare. But how do they determine that? We were lucky if we all live 50 to 100 years. I don't know anyone who's come back the same way we live this life, Herb. And no, this is it. And so if we don't prioritize our health, both in terms of dollars and care, then I don't know what we're doing here, to be honest.
Yeah, you're right.
I don't know.
And how do you see AI in medicine?
What's interesting, AI, augmented intelligence versus, if you want to call it, assistive intelligence. There's all these different words. So the terms that are being used for AI now, and the AMA is trying to push a definition as well. So it's artificial intelligence versus augmented intelligence versus assistant intelligence. And I think the way physicians would like to see it develop, from what I understand, is we like to look at it as an adjunct that we can use, a tool in our toolbox to help us, not to take over and make the decisions, but for something for us to consider in making our decisions. And that's where it gets a little dangerous, because if it's going to impact our healthcare to a point where it's directing our care, where physicians are deferring our thoughts about what should be done to the computer algorithm, the machine learning mechanism, then I don't think it portends well for our health.
I have a lot of experience with AI medical scribing softwares. A lot of the doctors are apprehensive to use it because they feel it's not perfect. It makes a lot of mistakes. They have to review things. I tell them all the time, I said, you should be happy it's not perfect. This way you have job security. If it was perfect, we'd have nothing to do. So it should be only a tool that we use. It should not be a replacement for us. Now it's become smarter, where I've seen some companies where they actually have ICD-9, ICD-10 diagnoses embedded into their progress note. I would say 70% of the time, it was 60 to 70% of the time, it's okay. The rest, it's wrong. But I can't have one wrong diagnosis ever in the note. It's getting better, but it just should be for a super, super duper progress note. That's all it should be used for, not for a replacement of us.
Yeah, so we've been also using vaccine predictive engines. And it is a problem because in Virginia's medical assistants and New York's LPNs, they just look at the computer and they say the computer says to do this, and there's no thinking involved. And if you're just following the routine schedule, the computer's pretty good. But if you fall behind, there's all these rules about you can't do this vaccine after this age, and they have to be this many days apart from each other. And it's not an easy calculation. And the people that don't have MDs behind them don't understand the complexity of vaccines. And they just look at the screen, and the screen says, do this, they want to jump to. And it's a little aggravating to try to tell them, don't do that. And they're like, but the screen says. And that I think yes, go ahead.
No, George wanted to say something?
The vaccine logic is always flawed. It's always flawed. There's mistakes all over the place because it's basically garbage in, garbage out. If somebody inputs the wrong date, the rest of everything else will be wrong. It still requires physician oversight. I guess the end of medicine will be the day that these computers get a medical license, because fortunately they are not able to get one. They don't go to medical school, and they will never have a license to practice medicine. So I guess we'll still have a job.
I'll tell you, I had an interesting conversation. We had a College of American Pathologists government affairs meeting in DC this past weekend, and I had the opportunity to speak with, that's why I'm looking down, I get his name, we had a guest speaker, and I spoke with him in the hallway after his presentation. It's a gentleman named Congressman Ober, and he's from California. He's a Republican from California, District 23. And he was talking about AI. He is the chairman of the bipartisan committee in Congress for artificial intelligence. And they just completed a report, which is available online for free, of course, a government document. And he spoke about AI in healthcare. And so not everyone had an opportunity to ask questions. So I met him in the hallway and we spoke for about 10 minutes. And I expressed to him one of my major concerns. But before I get there, he gave a very optimistic view of AI in general and in healthcare. And he's not wrong. Right now in this discussion, we're focusing on our concerns, right? But it's a very powerful tool, and it will revolutionize, like it or not, the way we do many things in society, and no doubt healthcare. Putting that aside, there are legitimate concerns in every sector, but we're talking about healthcare right now. And what I brought up to him is if AI becomes a standard of care in any specialty of medicine, whereby if a physician doesn't consult AI, and number two, do what AI tells you to do, that you could be liable for adverse outcomes, that's obviously a major shift in how physicians are going to look at practicing medicine. As I discussed with him, the standard of care issue, we got granular, and the reality is that the AI generators are just probabilities. Just like when we make a medical decision, we have a certain degree of probability of something happening, of what something might be in terms of diagnosis, or whether it might respond to treatment or not, what kind of side effects might occur, and whether the patient can be cured or not. These are all probabilities, and they're based generally on research experience, historical research experience, remote or recent, or both. And so the issue really becomes, is the human mind, based on what we assimilate from the literature and accumulate in our own experience with patients, is our probability more reliable than what a computer algorithm is generating in terms of a probability? We didn't reach resolution in our discussion, but these are some of the concerns, and the standard of care issue would not just potentially adversely affect our practice of medicine, but also the court system, of which I wear the other hat for, because I end up getting continuing education on AI in the judiciary, in addition to courses and exposure in medicine. So I just wanted to share that with you. I hope it wasn't too convoluted.
No, it makes sense.
You know what? If you think about it, in the old days, when you had a case, did you look up every single case in a book before you did a treatment plan? You didn't look it up. You just did it. Why would you have to look up in AI how to treat something? Why would that become standard of care to do that? That's weird.
The problem was that if AI is dictating the standard of care, which it may be right, it may be wrong, it may not be the right approach to the patient in front of you, and that could be a problem.
Of course, I asked the Congressman, Ober, I said, and then how about who are the attorneys going to sue? We both laughed because we know the answer, the deepest pocket. So it's likely maybe there's a benefit for physicians there, and that it'll shift over to the AI, the generative company. So we just tongue in cheek left it that way, that the future is unknown. It's exciting, it's scary, and it most certainly is unknown.
Yeah. Eric, why is it important to you and Cheryl Ann to give back? And why did you choose Wigs for Kids as a way of giving back to the community?
You and George are both pediatricians, correct? Correct. And I'm going to tell you, I didn't have what it took to be a pediatrician. And I'm going to tell you a little story, if you don't mind. I went into medical school, Ohio State, my clinical years, and pediatrics was right were right up there, one of my top choices as a career. And I dove in. I wanted to do pediatric oncology. I wanted to do cancer work. I wanted to work towards saving lives. The first week on my pediatric oncology clinic, 3 children died of different malignancies, and I was a wreck. I couldn't separate my emotions from the professional atmosphere, behavior at all. I was a mess. And I would walk home from the Children's Hospital in Columbus, Ohio to my apartment, and I'd just be miserable. I'd be so unhappy. I was so sad. So the empathy was just driving me really crazy, not literally, but I was very sad, very distraught. And I remember speaking with my attending, a fellow named James Miser, and his wife, Angela Miser. They're both pediatric hematologists, oncologists, and he headed the program, the department at Children's Hospital for many years. He and his wife are now, and they retired into the UK, and over the years, they adopted like 13 children. So that's a whole nother story. But he looked at me and he said, Eric, then it's not for you. He said, it's really hard. There's not a month that goes by where I don't attend 3 to 5 funerals. He said, it's really hard. And at that point, I realized I loved pediatric clinic. I loved just the day in and day out general pediatrics, but I was ruined on pediatrics from that point forward. It was quite traumatizing. I don't mean to be complaining at all, but I was really deeply affected is the way to say it. And so I did not pursue pediatrics. So as I got older, I learned about Wigs for Kids. In fact, as I got older, I decided to donate. Wigs for Kids was founded outside of Cleveland by a hair specialist, a salon, what do they call those folks? A stylist. And he founded it outside of Cleveland when I was in medical school, and I heard about it then. And there are many others, Locks for Love, and all these others that do the same thing. But I remember I wanted, as I got older and I sold my hair, I thought, what can I do for these children, many of them who have cancer, that are in great need of hair pieces? And so I turned back to looking at Locks of Love. I looked at Wigs for Kids. I looked at a few others, but Wigs for Kids is very important for your listeners to understand. Wigs for Kids is the only one of those hair donation programs which doesn't charge families for the hair piece. All of the others do a sliding scale based on family income, but Wigs for Kids is completely free to the recipient, patient, family. So that really moved me, and I chose them. And it took me a little over 2 years to grow 15 inches. They took it off, and now I'm going to grow it out again. As long as God has me on this earth, I'm going to continue to do that and donate my hair.
So you have to have 15 inches of hair?
Yeah, you got to grow it out. The story is, they said basically 12, but I called in June, spoke with the donor specialist, and there was silence when I told her I'm ready to have it cut. It's 12 inches. She said, there was silence. And then she said, Dr. Wargotz? I said, yes. She said, I don't want to burden you, but we have a very high need for long hair by little girls right now. We don't know why that is. So if you could grow it a little longer, we'd really appreciate it. So I ended up wearing it long and longer through the summer, where I had hoped to relieve myself.
So it took you 3 years to grow it out?
To a little over 2 years. Yeah. From where it is about now.
Oh, wow. That's awesome that you did that. My hair doesn't grow that fast.
It's very satisfying to know you can help people. I enjoy it, and I live for it.
And Eric, what is MedChi, and what do you hope to achieve during the years present there?
So MedChi stands for Medical Chirurgical Society of Maryland. It was founded by an act of legislature in conjunction with several colonial era doctors. It's one of the oldest medical societies, I believe 1799, if I've got that right. And I'm being installed as the 178th president, the first pathologist. And what does it mean to me? I'm deeply honored by my fellow physicians of Maryland. and those of MedChi to be elected to this position. And it more than that, it means I can have a voice that an additional amplified voice of where we as MedChi feel that Maryland medicine should go in terms of Maryland's practice environment for physicians and the healthcare delivery systems in Maryland, and of course, the public health and safety of our patients, our citizens here in Maryland.
That's a 1-year appointment.
It's about a 3-year hitch in that as president-elect, you serve a year, and then you are the spotlighted active president for a year, and then you're immediate past president. Together, you all, along with the CEO, you form the executive board, where you help, along with the board of trustees, essentially direct policy and direct traffic, basically, in the organization.
And what is the organization's, like right now, what is their biggest concern? Is payment on top of that agenda?
Payment, and I'm glad you used payment, because a lot of physicians and a lot of payers all use the word reimbursement, and it's far from it. It's not reimbursement, it is payment. Physicians deserve to be paid fairly for the services we provide. So I thank you for making that distinction in your mention of it. Organizations, medical organizations, generally play defense and play offense. We deal with legislation at the federal level and at the state level. And so there's things you defend against, like the trial attorneys. Some are very dear friends, but still they're often on the opposite side of the fence when we're talking about malpractice reform. We have a cap on non-economic damages in Maryland, and every year, the past few years, they come to the legislature looking to raise that cap. And so we're always playing defense on that issue. On the scope of practice, some people may not realize when physicians and healthcare professionals are speaking of SOP, that's what they're talking about, folks, scope of practice. There's always challenges to scope of practice by allied health practitioners, people who are not physicians, but are still called practitioners, and even some are called doctors. But in Maryland, only MDs and DOs are entitled to use the title of physician. So I always like to make that distinction as well. And we need the allied health people. We need physician assistants. We need nurse practitioners. Nurses are wonderful people, givers, caretakers. These are great people. But what happens is their organizations, through lobbying efforts and proposed legislation, they want to expand their scope of practice into areas which have been traditionally the realm of practice in delivery of care by physicians.
Yeah, I just saw that in California, the nurse practitioners are trying to take the name doctor. Some nurse practitioners do have a doctorate of nursing. And they passed a law that says only physicians and MDs and DOs can use the term doctor, because the public understands something by that title. And it's not that you're a doctorate of nursing or a doctor of engineering. It's that you're a physician. And so they passed a law with only doctors, MDs and DOs can be called doctors or physicians, as to not confuse the public. And you're also a Middle East expert. Are you optimistic that we're finally close to having some peace in the Middle East?
You're very generous to call me an expert. It's interesting. I seek recognition because I have a lot of knowledge and opinions about that. And I've spoken to many people, and then it shows up in their articles or their opinions. I'm thinking, I guess everybody for themselves. But I try to put my ego aside and say it's all for the greater good. It's not so much whether a accomplishment or something is attributed to you, as it's more important if it contributes to the greater good. So I try to keep my ego in check. But I like to think of myself in that area, but I'm not sure I'm recognized. So you're very kind. But I'm optimistic because I don't know what else there is. Because it's been so horrendous over the past 2 years. It's been horrendous for many years, even before the establishment of the state of Israel. It's been Go back to Roman times with Christ on the cross. There's been turmoil. It's been a zone of turmoil even from ancient times. And I think part of it's because it's at a crossroads. In ancient times, that area was at a crossroads between what we would call the East and the West. In terms of, you're talking about Asia, you're talking about Africa. So you're looking at it, it's something in the middle. And it's been conquered a million times over by just about everybody. And there's still a lot of tumult. Obviously, everyone's aware of the turmoil there. But I am optimistic. I'm always optimistic. You have to be. You can't look at it that it's always going to be a war zone, like any place. Look at Ukraine and Russia. So anyway, I have a lot of strong opinions about a lot of other things, and always happy to go there, but I'll take your lead on how you want this discussion.
I just hope that there's peace in the Middle East. It's, like you said, like people forget that the Jews were enslaved by the Egyptians for 800 years. And then Christ was crucified there. And it's just, it would be nice if they could live in peace and prosper. That would be nice for all of them.
Yeah, you're absolutely correct. And there's no reason they shouldn't. Again, going back to, we're all related. We're all just different degrees of cousins. Maybe we're 100,000 degree of cousin instead of a first degree cousin. The science doesn't lie, right? We all got the same number of chromosomes. We're all related. We all live 50 to 100 years. What are we doing killing each other?
No, it's like I say, some people are offended by this. I'm a Catholic, and Catholics are nothing more than rebellious Jews of the Pope.
You're a brave man. I would love that we can have that discussion sometime too.
You know, but it's true. Jesus was a Jew, and we believe in one God. We share a Bible. And Muslims, Jews, and Christians, we come from the same house, just different branches.
And a lot of people, a lot of purists would say that God's word in each of the holy texts, the Quran, the Old Testament, the New Testament, which form the basis, the underpinnings, the foundations of these three religions in written form, that they're not pure. They're impure because they were written by man. They're the word of God, but they're transcribed, and ultimately, to some extent, it can't be helped transmuted by man. And so I know that's a very controversial statement, but so any criticism of those documents will not be directed at the God, Christ, the Holy Trinity, or Yahweh, or Allah. They're to be directed at the people who wrote the word down. So it's
that's
not
a good way of looking at
inconvenient.
it. But and I do wish there's peace, both in Ukraine, but I hope there's peace and prosperity for the people of the Middle East. It'd be nice to see in my lifetime. And then it's an interesting question, because I know you're a voracious reader. What book would you recommend for pediatricians who are leaders in their industry to read?
Boy, that's for pediatrician.
Yes, most of our audience are pediatric leaders. They run their own practices one way or the other, big and small.
When Breath Becomes Air, are you familiar with that?
No.
It's written by a young neurosurgeon of Indian background, but it's of no consequence. I merely mention that because there might be some cultural things that enter into his story. But it's a volume that was completed shortly after he died from cancer. He was diagnosed with cancer in his residency, his neurosurgical residency. And he essentially journals his life before, his life at the beginning when he was having symptoms of what he and his wife went through, and his journey through it all, knowing that he was terminal. And he passed away, I think, in his last year or just beyond finishing his last year of residency, a neurosurgical fellowship, I guess, following residency. And it's a very moving book, and it's a very flawed book in the sense that the book itself is not flawed. We all are flawed individuals, and there's parts of it which he realizes that maybe he's been focusing on the wrong things in life, in his brief life, and he certainly expresses some regret. And I think there's a lot to learn by anybody, but I know it's been particularly enjoyed in terms of self-reflection by physicians who read the book. And so including pediatricians among that, of course, as fellow physicians, I think you might find that book interesting. It's his journey. His wife and the publisher pulled it all together after he died. It wasn't quite ready for publication.
And so what's the title again?
It's When Breath Becomes Air. So it's like when when your biology ceases to exist, and all of that breath just becomes air. It's just
What a beautiful
really
title.
philosophical.
What a beautiful title.
So I'd say if you haven't read that, you can get through it in a day or two, but there are some chapters which are you see a progression of somebody who's focused very much on himself and his own ego, narcissistic, as many professionals can be, to become more generally in tune with what he believes life should be and what's happening to him.
That's awesome. Thank you for that recommendation. We've taken quite a bit of your time. Really enjoyed this time together. As always, I enjoy time with you. You're always very generous with your kindness and your advice and your friendship, and it means the world to me and my family. So it's great to have you on the podcast.
I'll tell you, it's lovely to meet you, George, and Herb, your family. We love you and thank you for this opportunity to talk and casually in the lounge here and cover a variety of topics that at least you feel are of interest to your listeners. I'm not so sure, but if it is, if I've been entertaining or informative, I'm grateful for that.
You certainly have. Thank you.
Thank you.
Thank you for listening. This has been a production of the Pediatric Lounge. On the show notes, you will find links to our co-host and other important notes, as well as a timetable of the topics discussed today. Don't forget to follow us on social media and subscribe to wherever you listen to your podcast. Leave us a great review, as it helps us greatly. In the meantime, we will see you next week, the Pediatric Lounge. The conversations are not intended as medical advice, and the opinions expressed are solely those of the host and the guest.